using 5-pound weights before, go down to 2-point weights for 2-pound weights for a little bit until you kind of determine if you can handle that level of exercise before going back up to heavier weights. Okay, and the same with the reps. Okay, as far as driving, I think that's a little bit of a more difficult situation. Okay, I don't think at this point you're probably in any situation to drive. My concern really would be reaction time.
Yeah.
Right, because probably stop and go, you may be okay, but kid runs out in front of your car, somebody suddenly breaks in front of you, I'm not sure if your reaction time is going to be quite there to be able to stop fast enough.
Did you get a chance to go over the MRI that he had on Tuesday?
I didn't see the MRI. It wasn't, I don't think I ordered it. Who ordered this?
Dr. Scott. Yeah.
It looks okay. There's some chronic stuff.
I'm sorry, Dr. Concepcion, what does that mean?
So there are some old, very small strokes in here.
Yeah.
Some of them have been there for quite a while, it looks like. And there's a couple of new areas. A lot of this is going to be age related.
So on December 5th, we've got a appointment with Dr. Nakamoto to resume care. Would that be something we would follow up with him a little bit more further?
I mean, you can ask him what he thinks about it. I think at the end of the day, this is going to be controlling sugars, controlling cholesterol, controlling blood pressure.
Who's Dr. Nakamoto?
That's your neurologist.
The neurologist. You know, so I think at that point, this would be, like I said, controlling risk factors for stroke, right? Which is trying to get your cholesterol, you know, keep it under 100, keep your sugars under control, keep your blood pressure under control. Because those are the things that increase the risk for stroke.
Okay.
Okay. Any other questions for me today?
Well, we were concerned about the big D word for him, but you're not seeing that.
You mean dialysis?
No.
What?
Oh, that too. Good.
What's the D word you're talking about?
Dementia.
So Dr. Nakamoto can probably steer you in a better direction for that. There is no definitive test for that.
Mm-hmm.
Generally speaking, that is going to be a combination of things, combination of testing that would kind of lead us to that diagnosis. We usually recommend some fairly intensive memory testing. What Dr. Nakamoto and myself can do in the office is fairly brief memory testing. Sometimes based on that, we can get a better idea of whether or not we should be more concerned about dementia than average. But many times we do send for further testing if we're questioning the diagnosis. This is usually done with a neuropsychologist who's a specialist that evaluates multiple facets of memory. Most people think of memory like short-term memory and long-term memory, what you can remember. Mm-hmm. But there are other, forms of memory like working memory and functional memory and executive memory. All of these are types of memory that we can kind of test for in different ways. They can sometimes give us a better overall picture of how the brain is working and what parts are average, better than average, or below average, and can give us a better idea of what's going on with the memory.
Yeah, he was so bad when he was first at Castle, and then as soon as we brought him home that night, he fell twice. So we just took him to Strop because that's where all his records and doctors are.
Mm-hmm.
And he doesn't remember any of that, but Dr. Kai then was able to do the angiogram and the surgery, and
Mm-hmm.
he's much better once
Okay.
he started getting some blood supply. But we're seeing changes here. And one of the doctors, when they had a CT scan when he was admitted to Strab, and she was concerned about some vascular problems, and she was talking about white brain matter. I don't know what that was.
So that's why we did the MRI. I think it gives you a better idea of what's going on with the brain.
Yeah. So, but it doesn't sound like it clarified anything. It sounds like it
Well, we know that there's some vascular issues, and those vascular issues are related more to, small strokes that we've seen.
uh-huh.
Okay. Definitely vascular issues in the brain and history of strokes in the brain can increase the risk for dementia, right? This is really semantics as to what type of dementia it is.
Yeah.
But more and more we have more and more, particularly for something like Alzheimer's dementia, we have different treatments, right? In the past, dementia was dementia. We treat it kind of all the same.
Yeah.
But now, if we know there's a vascular dementia, that means there's been history of strokes. We need to make sure we're controlling the cholesterol and controlling the sugar and controlling the blood pressure,
Okay.
right? Versus an Alzheimer's dementia where there's now, newer treatments and newer studies out there with better options for treatment specifically for that type of dementia,
Okay.
right? So the type of dementia in the past has been really, like I said, semantics. It's like you have dementia, right? Like the treatment was pretty much the same. Here's some medication, let's cross our fingers, Hail Mary, right? I mean, that's basically it. But now we have some different treatments, and we want to be more focused on the treatment of how we're going to prevent, worsening of the dementia, progression of the dementia.
Yeah.
So, there are some other things, and that's probably why they did the MRI, was to look for, are we seeing these small strokes? Yeah, we're seeing the small strokes. Is it unusual for a 79-year-old? Not necessarily, but if it is causing you memory problems, that's different.
That's what we're seeing.
Right? So
You
the
see
flip side is it's
memory
not
problems.
unusual to have memory problems and be acutely confused, particularly when you're in the hospital, you're in an unfamiliar environment, and you're not feeling well. And we're giving you a bunch of meds, probably, right?
Yeah.
When we start messing around with medications, and you're definitely not getting good sleep because you're in the hospital. So they're waking you up every hour to check your blood pressure and do all kinds of stuff. I mean, it's not unusual for patients to be a little confused in that situation.
Yeah. Well, it was like when we were, he was getting the MRI the other night. They had to come get me to help you get dressed. And the technician said, "Oh, he seems like he's a little confused." And I'm like, "Yeah, that's why we're here." But sometimes just putting his clothes on,
Mm-hmm.
it gets a little tough.
Okay.
And he couldn't-
Even in the mornings.
Yeah, when you went and changed your pants today. So I chalked the other night up to, well, it's 7 o'clock at night and he's tired, but then
Mm-hmm.
we run into occasionally the same problems. He has a hard time lifting that left foot anyway, and then with what he's been through, it just makes it harder.
Gotcha.
And then he can't, lifting that leg and getting it in the right pant leg
Mm-hmm.
was difficult. You know, it's just little things like that that he runs into, or remembering every morning he had a routine where he'd weigh himself and take his blood sugar. And if I'm not standing here now to remind him to do his blood sugar, then he'll get distracted and forget.
Gotcha.
That kind of thing is, you know, it's just so many things that are happening that you compensate for, that you forget to point it out. And I don't want to frustrate him because he's working really hard to keep it all straight.
Gotcha. I mean, I think, like I said, Dr. Nakamoto will be better able to shed light on the memory issues. And if further evaluation is needed with a specialist that does some memory testing, and what options are available as far as treatment goes. He's usually really good at sending me a copy of his notes, so that should be helpful. If you see an acute worsening, though, you do need to let us know or go to the hospital right away. Like if he's a little bit forgetful today and tomorrow he's not communicative and he's very forgetful, and you're like, oh, this is a big change from how it was a day or two ago, you know, there could be something else going on to cause the mental status change.
Yeah.
Okay. And that needs further evaluation acutely. Otherwise, I would keep that appointment with Dr. Nakamoto, and hopefully that will give us a better idea of where the memory is right now, and what options are available for further diagnosis and treatment.
Yeah, you know, it doesn't change anything for him aging and moving forward. It just helps us to know what's going on so that we can deal with whatever is happening. When he forgets and ends up out of the pond and falls down,
Yeah.
he still thinks he's Superman. And
All right.
forgets
Well,
that
we'll
he's
definitely, we'll definitely keep an eye on it. But if, like I said, if you feel like it's acutely worsening over a day or two, let us know so that we can do some further evaluation right away.
Okay.
Okay. And then you're gonna get your blood test next week.